be that may promote recovery of function, or you're doing something, it turns out, that may actually work in the opposite direction of the intention of the treatment we're trying to provide in our experimental protocol. We don't know anything about that. We're also completely unable to get any direct measurements of what people are doing in their measurements that may be important outcome measures. So just like measuring the speed of walking 50 feet may be a solid outcome measure in that, well, it's reproducible, it's reliable, and all that. The question is, does it have any ecological meaning? Does it have any meaning in relationship to what people do every day? If we could measure what people were really doing, we would improve our ability to measure outcomes, and we may be able to have more sensitive measures of outcome to be able to begin to show that some of our treatments that we didn't think worked so well actually are much more robust in a real-world setting. Or they're not so robust in a real-world setting, and it doesn't matter that Dobkin can get you walking 25% faster in a laboratory setting, because at home, you're not able to do that. We rely a lot on ordinal scales. And I'll give you an example of that, and basically surrogate measures. So that 50-foot walk is a surrogate measure for what you're really doing in the real world to be less disabled. Our outcomes often have very little meaning in our clinical trials to patients and physicians because they're not palpable. You know, saying you walk a little faster, 20% faster, walking 50 feet, I mean, what does that have to do with anything? Maybe if I couched it in terms of, well, you couldn't walk across the street before the light changed, and now you can, you know, that would have a little more meaning. If I said, well, now you can walk at speeds that allow you to go to church